The state of the health in Uganda. One of the things that we still need to sort out is COVID-19. Yes, the statistics may have come down in terms of the death rate, the infection rate, but it's still looming amidst us. You and I know people who have gone to the hospital and they've been diagnosed with COVID-19. Now, here to address this issue and give us a ray of hope is Mildmay Uganda, which is a hospital that is ensuring that they invest as much as possible in research and in the healthcare system to be able to provide the best and adequate service to you who needs attention to whatever illness, whatever sickness that you are being challenged with. So improving the quality of healthcare is one way we want to take this conversation. And I do have the director of Mildmay Uganda. Good morning to you.
Good morning.
You're most welcome.
Thank you.
Now, usually by the time you get to director, there's like a whole list of accreditation you have on yourself. Yes. So could you give us an introduction?
Yes. Good morning, viewers. Thank you for this opportunity. I'm called Yvonne Karamaji. I'm the hospital director of Mildmay Uganda Hospital. I'm a medical doctor, a public health specialist, and over 20 years of experience of working in the medical field. Yes.
Okay. All right. Now, as an administrator, I know that Mildmay has been very intentional in leading the fight against COVID-19. Right now, what's the status of COVID-19 as far as the country is concerned, but also in regards to the people that walk into your facility?
Okay. Thank you very much. I'll just allow me to first say who Mildmay Uganda Hospital is so that we can have the perspective of our work and contributing to that fight. So Mildmay Uganda Hospital is a general hospital, meaning we give a range of medical services for children, neonates, adults, and the elderly. So we give general medical care, we give surgical services, obstetrics and gynecology, that's for the pregnant moms and gynecological issues. We have specialist clinics like the eye clinic, mental health. We do also community outreaches where we partner with different entities, Rotary and others, to do community outreaches. And we have inpatient services where we do have admissions for different medical conditions. And we also provide our care in partnership with medical insurance companies. So we have more than 10 insurance companies at Mildmay: UAP, Liberty, Sanlam, IML, AAR, Prudential, the whole long list. Yes, so that is who we are. We're situated on Lueza, on Entebbe Road. Regarding the fight against COVID, our contribution, and we continue to contribute. The current status, I think we have over 64,000 cases active in the country, but we are a health service provider. So what are we seeing on ground? Yes, we are seeing more cases. There will be spikes because it's a virus, it spikes. Maybe every 6 or 8 months we'll have spikes. So we are going to live with this disease. But we are providing vaccination services. You can come to our hospital Mondays and Tuesdays and we vaccinate you. We have the vaccine available. We have COVID-19 testing services. And even during the pandemic, we were supporting the national system in providing testing services. So we've done lots of testing. We test travelers. If the country you're traveling to requires those requirements. We are supporting, working through CDC, giving messages of hope on different media platforms to support. But like I said, we're a care facility, so we actually manage COVID-19 cases, be them outpatient or even for admission. Yes. As
of yesterday, what's the status on the COVID-19, the cases that are coming in at Mildmay Uganda?
Okay, so our status normally mirrors the national status. The last few weeks, maybe let's say out of every 10 clients, we could have about 4, but they are mild cases. Most of the patients we are receiving are mild cases, and then we do have a few higher risk cases. These are people of a certain age, majorly maybe above 50 years old, coming in with severe bronchopneumonias. We've had people with diabetes, but we're able to manage them because what has happened is that most people are vaccinated, so we are getting milder cases. The variant around is less virulent than Delta, so that helps. And there's some degree of herd immunity, whereby we've had a lot of exposure, such that even those who are not vaccinated are coming up with a less severe disease. So yes, they are coming sick, but we are not having deaths.
Okay.
as our current status.
All right. I know that you do have partners with whom you've come on board with to actually extend these messages of hope against COVID-19 to communities. Tell us more about that.
Yes. So through PEPFAR, and they work through CDC, they have supported Maldme Uganda as an organization where we partner with different faith leaders of all faiths, Muslim, Christian, and these faith leaders are capacity build. We go on different media platforms, both in print, and they give messages of hope, encouraging people to vaccinate, giving their testimonies of vaccination. But we also provide materials, information, communication materials on COVID-19 messages on social media. So these are available and can be easily used to communicate to the masses. And on top of that, we've done public rallies in different districts. And these leaders are at the forefront because the community relates to them. So if my religious leader thinks it's okay, then most likely I'll take it up.
Okay. During COVID-19, when the vaccination campaign started, people were disturbed by the information that was looming around against the vaccines. And have those issues been sorted since then? When you're giving vaccines to these people, when they come to take the vaccines, do you actually first help them understand what they're taking in? And in terms of consent, do they get to consent with an informed mind?
Yeah, that's a very good question, and it is true. Those concerns continue. So before you start with health education, but even with the individual, young people, especially young men, are very concerned, you know, about will it affect my sexual health? Young women are like, will I give birth? You know, so those questions continue. These vaccines, based on the science so far, they are safe in all those populations. So it still remains paramount that as a health worker, you must health educate. If you do not health educate, you'll give the first dose, they won't come back for the second. So that remains very important.
Okay, so tell us more about the importance of an accredited health facility in terms of healthcare, especially with the lab that you have at Maldme, Uganda. What's the importance of people going to such facilities in order to get services that are worthy of sorting out their problems?
Yeah, thank you. So accreditation means that your place of work has been given that symbol that symbolizes quality. So at Maldme Uganda Hospital, we actually have several symbols of quality. One of them is the laboratory services. We have the ISO 15189. They have numbers, which mean that your lab meets the international standards of other medical laboratories worldwide. Then our hospital management system is also ISO certified 9001. It means that the way we give our work, we have to be professional. I was talking to you about customer-centeredness. It is not just literal, it has to be walked. So the benefit of going to a facility that is accredited, that has that mark of quality, one, to you as the patient, you then trust the system. It is important to trust your service provider, that the test they are giving you is the result that you hope for because you're paying for it or somebody is paying for it. And so I think to the customer, that customer assurance. And I think also as a nation, as an entity, you then don't have to go out of the country for the similar tests. We are able to bring that to you here. We are saying we're aspiring for middle income status. And those are some of the things in middle income countries. You have certified lab services. And generally to the nation, we train other labs in quality systems. So we are training others to do it well. We teach students at Maldme. We have schools for nurses, lab technicians. So our lab technicians get a test of what it means to work in an accredited institution, and when they leave, they are more employable. But also we are building the capacity of the nation, making sure that you have access to quality care. You don't always have to get on a plane. And COVID-19 taught us that you need a hospital, you need a service within your access, because borders can be closed. And you need to get to a hospital in the first minute, in the first hour. I'm telling you, for medical emergencies, the first minute, the first hour, always important.
Critical.
Then you can be referred, you know, in a way to another higher level facility. But that's why accreditation is important.
Okay, all right. And also, there's always the question, private sector of health, how do you measure standardization? How do you measure the quality of service that you offer that is continued? And it's the same for the person who came in yesterday, today, and tomorrow.
I think I'll give it a more simplistic touch. I won't go through all the measures. I think the ultimate measure is your customer satisfied. So you must have different ways of measuring customer satisfaction. If you come to a hospital, was it given in good time? Did they talk to you? Did you feel helped? And did you get well? So ultimately measuring your customer satisfaction, but using medical parameters and talking to the clients is a generic way of putting it, but we have actual standards that we follow and track.
And finally, it sounds like Mildmay Uganda is a one-stop center for anything medical or health related. How can I access your services?
Okay, so you can reach us on our toll-free line, you know, just to find out about it's 0800 111 458. You can call us to find out what services are available. We have a website, mildmay.or.ug, Twitter handle Mildmay Uganda, and also we are situated on Entebbe Road, like I said, 12 kilometers from town, Lueza, near Fuelex, and we're there. Yeah.
Okay, all right. That's Mildmay Uganda, and their commitment towards the fight against COVID-19 continues. And I like the approach that they're using. They are using community outreaches. They are engaging community leaders to be able to be vocal about these conversations and create